London Real, sponsored by Bulletproof Coffee.
How important is that first hour? Because I read something about like soldiers in Afghanistan with the U.S. and they've cut the time down from like 2 hours to 30 minutes, where they go from the battlefield to treatment, and it makes such a huge difference.
It's what we call the golden hour. I mean, it's
Golden
crucial.
hour.
I mean, the whole story behind how the whole trauma life support thing came about was he's an American guy, I think in the late 70s, who was involved in a light aircraft accident with his family, and they crashed a plane in a fairly remote area, sort of in the Midwest of America, I think. And I think the treatment that his family got was poor. The way that the emergency services responded, and I think basically they all died apart from him.
Wow.
And then he took away his experiences from looking at what they did, and he felt, he was an orthopedic surgeon, I think, and he felt that he could create a sort of a pathway or a way of caring for people in the trauma scenario that he could have done better on his own without them there than they provided. He could have done better with no medical services available to him, and he created what's called the Advanced Trauma Life Support courses, which we all do now. And it's an American thing, but it's been incorporated by the Royal College of Surgeons in the UK. And you know, the golden hour, they preach, you know, that this is the time that you can save lives in that first hour. I mean, you get 3 peaks of death in trauma. The first peak's in the first few seconds, and this is usually due to some sort of trauma to one of the great vessels, you know, the aorta. You know, you may, you know, perforate your heart or your ventricle, or or some sort of major airway problem where you basically obstruct your airway and stop breathing. And he decided that there was, you know, this whole ABC principle. I don't know if you've heard of the ABC.
No.
So
Dude, I find this really fascinating.
Yeah, me too.
So you know, our first priority, the first thing that's going to kill you is your airway.
Okay.
So you have to, the first thing you do if you have a trauma patient is you stabilize their airway, you know. And a good way of assessing that is if a patient can talk to you, they've got a patent airway, you know. And if not, you need to do something to assess that further. And you
So you look, if they're struggling to communicate via speech, it's a high
I mean,
probability
that's
that airway's
something you can
blocked.
look at, different noises that they make, you know. Patients, you know, they can, you know, when you get involved in trauma, things can block the airway, your teeth, vomit, blood, you know, these sort of things. You have to clear that out. You may have to, what we call intubate a patient, which is introduce a tube into the trachea, and then you can plug someone into a ventilator, or you can bag them, and then you can breathe for them.
Is that dangerous if someone does that on their own? I mean, you always hear take the pen and get the tube and then cut, you know, the trachea and stick it in. I mean, is
you
it
kind of need to have some knowledge of what you're doing, probably. So I wouldn't advise you
a
guys to go
horizontal
out.
cut or a vertical cut? Or maybe we shouldn't be saying this.
You can actually do, this is what you're describing is a cricothyroidotomy, and there was a paper published not too long ago that showed that it probably doesn't work with a biro.
A biro?
I've never read this
What's
paper.
it's a British word for
like
a pen.
Okay.
So the sort of famous story of, you know, some doctor being on a plane with a coat hanger and a pen, you know, and
It won't work because the airway's not big enough.
I think, you know, you can only, and also you need some sort of supplemental oxygen. You need to be able to ventilate the lungs. You know, your tidal volume, the amount of air that's going in and out of your lungs, we're looking at, you would probably be about 500-600 mils. You can't deliver that through
Is that per breath?
per breath.
Okay.
Yeah. So you can't deliver that through a biro or a pen. You know.
Okay.
That's intense.
Wow.